Okay.
Yeah.
Irritable bowel syndrome. Well, that sounds interesting. Do any of you suffer from irritable bowel syndrome? Well, let me tell you a little bit about it. Irritable bowel is the cause of a vast amount of stomach aches in the United States. And the majority of this dreaded problem is caused by stress. Surprise, surprise. Research has shown that the acids in our stomach are produced more rapidly while the adrenaline is released in our brains due to the cause of anxiety and stress and worrying about the little things. I have suffered from irritable bowel syndrome for over 10 years or more, and I would like to discuss what to look for in the symptoms of IBS and when it may be time to go to the doctor. The testing that can be done to tell us if we are an IBS sufferer and the treatments that can be done to help to prevent painful and dreaded waves of IBS. So if you see my little video over here, or my little slide, you'll see the links between stress and IBS. One is imbalanced flora, infection. Other factors can cause from endometriosis, which is hormonal imbalance, environmental factors, malabsorption, inflammation, anxiety and stress, incomplete evacuation, bloating, diarrhea, food sensitivities, which are allergies, latex even can cause it, so pretty interesting facts there. First of all, I would like to talk to you about the link between stress and stomach aches. Yes, there are many factors that can cause IBS, such as environmental changes, food sensitivities, hormonal imbalance, and imbalanced flora, which I just went over with the slide. Excessive stress due to social changes such as being laid off, divorce, marriage, loss of a loved one, all can cause our bodies to go into mode of survival. The release of endorphins or even acids that are caused during stress on a continuous basis will cause a breakdown in the stomach lining. It will also cause a lowered immune system. Edward Blanchard, PhD, professor of psychology at the State University of New York at Albany, says that the most common mental ailment suffered by people with IBS is generalized anxiety disorder. He suspects that more than 60% of IBS patients with a psychiatric illness have GAD or GAD. Another 20% have depression, and the rest have other disorders. Let me tell you now a little bit about how irritable bowel works, or with what it actually does in the stomach of a sufferer. According to Gastroenterology and Hepatology Journal, which is part of the U.S. National Library of Medicine, the gut is a very complex entity. There is a normal contraction process that occurs in a normal patient that allows for a movement of digestion and removal of bowel. Yay, isn't that fun to talk about? In an affected person, these contractions are found to be altered. Now, what is causing the altered contractions is what they're researching, but over the last few years, a large rise in gut motility, bacterial overgrowth, and visceral hypersensitivity are what they're finding from their research. Some people are worriers, and just the little things will stress the stomach, causing them to be in constant turmoil.